Hi, I'm Joan. I'll be the nurse looking after Billy today. First of all, I'll be providing some important information regarding the condition croup, which Billy has been presented with. So what is croup? Croup is one of the most common respiratory illnesses. It is a viral infection that is caused mainly by the parainfluenza virus. The virus then leads to the swelling of the voice box and windpipe. This swelling makes the airway narrower, so it is harder for the child to breathe. It is most commonly seen in infants to children from 3 months up to 5 years. So how do you identify croup? Croup usually starts off like a cold, having fever, runny nose, and cough. But there are also some other signs and symptoms to look out for. And what are they? Paradoxical chest retractions. Paradoxical breathing is when the chest and the abdomen are moving opposite of each other. So when Billy breathes in, we can see his chest rising but his belly falling. And when Billy exhales, we can see the opposite, which is belly rising and the chest falling. Wheezing, which is a tight, whistling sound we can hear from Billy's each breath, that indicates his air passages may be smaller, making it more difficult for him to breathe. We can also see that Billy is using his neck muscle and the muscle under his ribs, which means he's using his accessory muscles to breathe as he finds it harder to use his intercostal muscles. Inspiratory stridor. Stridor is when you hear a high-pitched noise on your child's breathing, which is due to an upper airway obstruction. If you do suspect that your child is experiencing stridor, do not put anything in their mouth as this can cause complete respiratory obstruction. We can also see how Billy is experiencing stridor as he can hear the high-pitched noise every time when he breathes. Barking cough is one of the most common symptoms of croup. It is a cough that almost sounds like a barking seal, which is also a symptom that Billy is experiencing. This occurs when the larynx, also known as the voice box, swells and constricts the airway. And grunting. Grunting is gurgling noises that we hear from Billy as he is trying to keep the air in his lungs so that they will stay open. So why is croup common among children? This is because children have horizontal and cartilaginous ribs, so their chest wall collapses inwards and the work of breathing is increased. Children also have smaller tracheal diameter compared to adults, which increases their airway resistance and means that even small amounts of mucus can obstruct their airways. Children also have higher metabolic rates compared to adults. That means when the child is experiencing respiratory distress, it increases their need for oxygen and eliminates carbon dioxide. So what can you do at home to treat croup? A mild attack of croup is when your child has the harsh, barking cough but does not have any stridor when they are calm and settled, and they are not struggling to breathe. For this, no medical treatment is necessary, and you can usually manage this at home by keeping your child calm, as breathing can get more difficult when they're upset. If your child has a fever and appears to be irritable, you may give them paracetamol or ibuprofen. Paracetamol can be given every 4 to 6 hours in a day, and ibuprofen can be given every 6 to 8 hours, but no more than 3 times a day. As these medications are available in different strengths, always ensure to give the recommended dose that is written on the packaging according to your child's age and weight. Croup tends to worsen at night time, so make sure to spend the night with them and keep your child comfortable overnight. Call an ambulance or bring your child to the emergency department if your child is struggling to breathe, your child looks very sick, pale, and becomes drowsy, or if their lips turn blue. How is your child treated at the hospital? For mild to moderate croup, your child will be given a single dose of corticosteroid, which can be either prednisolone or dexamethasone. As Billy is experiencing stridor and retractions, he will be receiving corticosteroids. If oral corticosteroids are not tolerated, Then your child will be given nebulized budesonide. For severe croup, your child will be given oxygen through a simple mask. He will also be given nebulized adrenaline and corticosteroid. We'll consider discharge once your child is free of stridor at rest. On discharge, you will also be given a fact sheet on croup and the things you will need to look out for. Prevention of croup. It is not usually possible to prevent croup. Many viruses can cause it, and there is no immunization available against most of them. However, immunization against influenza is recommended, as this may actually prevent croup caused by the influenza virus. All children who are aged 6 months and older can be immunized against influenza. Hope all this information helps you, and all the best for you and Billy.